And it is the incredible privilege to enter into someone's life when they are very vulnerable and they are totally dependent.
It's a sandbox. You can design your experience. It really feels like it captures lightning in a bottle.
These are going to be the surgeons that are going to be looking after us and our parents and our grandparents. And it's very important that we invest in this generation of surgeons.
Our philosophy here is that the fellows are really the center of our practice. I always assume that at the start of the operation, it is the fellow who's going to be as involved in the case as they can be.
I was astounded at how quickly and capably they got me in the driver's seat, but I never felt like I was struggling in a way that was dangerous.
At university hospitals, we see well over 1.5 million unique patients a year. So you're going to get the breadth of everything. But at the same time, we're doing these procedures open, and we're also doing them robotically. We're one of the leading robotic programs in the country.
When we start using robotics, we use a multi-port approach that allows us to do bigger resections, more complex resections with better recovery.
You know, in our program, we don't just follow clinical guidelines, we're sort of helping define them. We are at the table at the STS, shaping the database and shaping the research that actually changes practice.
As a fellow here, I was able to pursue something that I'd never done before, which was to initiate a clinical trial. And I'm not sure that would be as easily done elsewhere.
To me, this is what drives the best care. We identify a clinical question in the OR, we translate that to research, and then feed that back to our patients to deliver things that really are cutting edge, both at the research and clinical levels.
One of the things that's very important to us is that our fellows don't get lost. And so the way we train our fellows is with an apprenticeship model. You may work with 1 or 2 surgeons during a certain period of time. That gives you a great opportunity to really learn how that surgeon thinks.
We're innovating and we're pushing the envelope, but also with the patient in the center of it.
Cardiothoracic surgery is hard. It's a lot of work, it can be emotionally trying, and you need a support system to get through that. I think everyone at UH and the system itself provides that. I think that Cleveland in particular has been a great place to live.
University Hospital supports the city of Cleveland fully, and I think that they work hand in hand. I made relationships which would last a lifetime, and looking back, I certainly made the right decision for me.
I'm the happiest I've ever been, and Cleveland has been a major part of that.
You get to operate on someone, which is the greatest privilege. And then when you see them the next day, the first thing they say to you is thank you. It's why we're here, to do the best we can.
University Hospitals is excellent for patients because it prioritizes patients.
The fellows, when they leave our program, they need to be good people. The patient is in the center of it, and if they can learn that, the rest of the knowledge is in the books.
When we train our fellows, we're really training them to be leaders. We don't want you in the audience, we want you on the podiums, and we're here to deliver on that promise. There's really nothing we can't do here.
Teamwork for me is key to absolute success, and there's no substitute to that. And I can tell you, I've not been in an institution where the passion for teaching is as strong as it is at university hospitals.